I'm Christina. I'm giving my verbal documentation on my head-to-toe assessment. My patient was a 15-year-old female that was awake, alert, and oriented times 4. The patient's nutrition status is that she obtains 3 meals a day. The patient's posture was erect and relaxed. The patient had normal gait and ambulates without difficulty. No devices used, no deformities, distress, or abnormal movements were noted. The patient was in good spirits, happy, hygiene well kept, and able to perform herself. The patient's speech, pattern, content, articulation was all appropriate. The patient's primary language was English. The patient's skin was warm, dry, intact, no lesions, bruises, scars noted. The capillary refills on the nails were less than 3 seconds. The nails were non-brittle, convex, trim, and no discoloration. The peripheral pulses were palpated and equal bilateral, which would be the brachial and the radial pulse. They were also strong. Moving on to the head and the face, the patient's scalp was free of masses or lesions or lumps. The hair was clean and maintained. The head was erect and midline, no lesions or swelling or discoloration. The face was symmetric, no weakness noted. Cranial nerve 7, which is the facial nerve, was intact with facial movements. The temporal artery was present. The TMJ was palpated, which was the cranial nerve 5. The trigeminal nerve was intact. Sinuses were palpated. The patient stated no pain or tenderness, which was on the frontal sinuses and the maxillary sinuses. Moving on to the nose was symmetric. The septum was midline. There was no masses or tenderness, no discharge noted. The patient's airway was patent. The trachea was midline. The thyroid was non-palpable when the patient swallowed. The lymph nodes were all negative, no tenderness noted from the patient. The lymph nodes would be the preauricular, posterior auricular, occipital, the submental, the submandibular, the jugulo-digastric, the superficial cervical, and then you have the deep cervical chain, you have the posterior cervical, and then the superior clavicle. Then moving on to the patient's carotid artery was palpated and auscultated. There was no Brught's or jugular vein distension noted or pulsations. The patient had full range of motion in the upper extremities. Muscle strength was strong. The cranial nerve 11, which was the spinal accessory, was present. The patient was able to shrug the shoulders. Moving on to the eye, the cranial nerve 2, the optic nerve was intact and present. Also, the cranial nerve 3, 4, and 6 was present and intact. The oculomotor, the trochlear, and the abducens nerve, which is for the pupil reaction, the accommodation, and the cardinal field of gaze. There was no irritation, crustation, discharge from the eyes. The conjunctiva was moist and pink. The sclera was white and glossy. The cornea was round. The iris was hazel in color. The eyelids, eyebrows, and the eyelashes were all present. The pupil constricted, equal, bilateral. Moving on to the ears were symmetric. There was no masses or tenderness felt on palpation. There was no earwax or drainage noted. The patient's hearing test was performed, cranial nerve 8, which was the acoustic nerve. The patient was able to hear and pass the whisper test, repeating all letters and numbers. Moved on to the nose. The nose was symmetric. There was no deformities. The septum was midline. The mucosa was intact. No swelling, no tenderness on palpation. The airway was patent. There was no lesions. The patient passed the smell test, which is the cranial nerve 1, the olfactory test. and to identify smell. Moving on to the mouth and the lips. The lips were moist and pink, no cracks or lesions. All teeth were present. The tonsils were present. There was also a permanent retainer. Noted on the bottom, the gums were moist and pink. The tongue was symmetric and pink, and there was no masses or lesions noted on that. The hard and soft palate was also noted and intact. The uvula was tested, cranial nerve 9 and 10, the glossopharyngeal and the vagus were each intact, along with the cranial nerve 12, which is the hypoglossal, was intact, the tongue movement. The thyroid was non-palpable, no issues with swallowing. Moving on to the lungs, posterior, the shape configuration was good, no masses or lumps noted or lesions in inspection. The CVA was non-tender for the patient. All breath sounds were heard on all lung fields. No adventitious sounds were noted. Moving to the front, the anterior, the shape configuration was good. No lumps or masses, bruises or lacerations. Again, all breath sounds were heard in the front. No tenderness on palpation. The heart sounds were heard. S1 and S2 were noted. The apical pulse was heard and palpated at the 5th intercostal space at the left midclavicle line. No murmurs or thrills heard. All locations of the heart sound were auscultated. Moving on to the abdomen was flat, symmetric, soft, no masses or swelling. The umbilicus was midline. There was no scars or striae. Bowel sounds were heard in all 4 quads. No tenderness on palpation, light or deep, or during percussion. The lower extremities were symmetric, warm, dry, pink in color, no lesions, bruises, or scars. The patient had no hair due to the patient shaved. The patient, all pulses were present and equal bilateral. The lower range of motion was strong and equal bilateral. Also, no swelling deformities noted. The patient, Romberg's test was positive. The patient did sway left and right. The patellar reflexes were positive on each leg. And the patient was tested for scoliosis, which was negative, and the patient's midline spine was midline and no abnormalities noted. And that completes my verbal documentation on my head to toe assessment.